Next, we're going to start on the temporomandibular joint portion of the school project. We are going to need some materials for this, a mechanical pencil for writing the names of these areas. We're going to use the white paint we used earlier on our school project. We need a light blue puffy paint to mark our disc or joint, and then we're going to use a dark green puffy paint to mark our ligament attachments associated with the joint. The temporal mandibular joint is a bilateral joint, so obviously one on either side. It allows for mastication in speech, and it is the articulation between two bones, the temporal bone here in orange, and the mandible here in white. A patient may have a disease process in one or both of the joints, therefore the dental professional needs to understand the anatomy of this joint. The temporal bone has three areas that we are going to note, and I've surrounded those in white paint. Pull this out for just a sec. And those are the glenoid or articular fossa, the articular eminence, and the post-glenoid process. So I've surrounded them, it's kind of almost a triangular shape in the white paint, and then I've marked those using my mechanical pencil. I've written the names of those areas on there. Get our joint reattached here. Okay. The mandible, the articulating area, is at the head of the condyle. You can see where that extends up into and corresponds with that articulating fossa of the temporal bone. There is a joint capsule that encloses the TMJ, the temporal mandibular joint, by wrapping around the margin of the temporal bone articular eminence, which is here, and the articular fossa, which is where that articulates inside there, and inferiorly wrapping around the whole circumference of the mandibular condyle, including the neck of the condyle, which is a little bit farther down. So this would be the condyle, and this would be the neck through here. The disc of the joint, I've used the blue puffy paint to mark that. It is located between the temporal bone and the condyle. And it divides, the disc divides the TMJ into upper and lower synovial cavities. These are lined by a membrane that secretes synovial fluid. The disc is attached to the lateral and medial poles or sides, so it's actually attached on both sides, even though we're just going to be marking it essentially here just on the outside where we need to see it. Anteriorly, it is not directly attached to the temporal bone, but only indirectly through the capsule. Posteriorly, it is attached to the temporal bone at the postglenoid process, which we've marked here, and the disc blends with the capsule. The posterior attachment back here is where the nerves and the vessels enter the joint. Over time, with trauma and age, there can be a thinning or perforation, calcification of the joint. Perforation and displacement can lead to clinical problems. Lastly, we're just going to discuss the ligaments associated with this joint, and this we're going to be using a green puffy paint, a dark green, and we are going to first mark the temporal mandibular joint ligament, or the TMJ ligament, which extends from the articular eminence down to the neck of the condyle, so it's going to kind of attach all the way through here, through this whole area. Okay, and then medially, if we flip our skull over here, we have the sphenomandibular ligament. Let's see if I can get this in the right angle so you can see it. We have the sphenomandibular ligament that attaches from the spine of the sphenoid bone. Okay, and then we're going to have the stylomandibular ligament that's going to run from the stylo process of the temporal bone. And then if we look at our mandible, we can see where those attach. So I'll just pull that off of there. So our sphenomandibular ligament, I've gone ahead and marked that here. It's going to attach, again, from the spine of that sphenoid bone down here to the lingula, kind of that little lip that is right over our mandibular canal. The stylomandibular ligament is going to attach similar to where the medial pterygoid attaches, so kind of near that angle of the mandible for the stylomandibular ligament. So I'm going to use dark green puffy paint to mark those. And that concludes our TMJ portion of this project.